Today we will discuss about the axillary artery. I have dissected the pectoral region and I will show you the dissection of pectoral region as well as the axillary artery. I have reflected the skin of the pectoral region as well as I have removed the skin of the front of the arm. After removal the skin, you will see there is a in this body very thin, so very little bit fat, so we will not see the any fat, but it is completely muscular body. But the skin, after the skin there is a superficial fascia, and then there is a pectoral fascia, and over the pectoral fascia mainly the retromammillary space, and over the retromammillary space there is a breast which is lies inside the pectoral region. This is the male body, so here this is the breast, and after the retromammillary space over the pectoralis major there is a pectoral fascia, and just below to the pectoral fascia there is a pectoralis major muscles, and after reflection of this pectoralis major you can see this is the pectoralis minor, and this pectoralis minor which is attached to the third, fourth and fifth ribs, and it is inserted on the coracoid process of the scapula. Same way the pectoralis major which is arise from the sternum from the second to sixth ribs on the margin of the lateral margin of the sternum, as well as the pectoralis major which is arise from the anterior surface of the clavicle, medial 2/3 aspect of the anterior surface of the clavicle. There is at origin of the pectoralis major, and this pectoralis major which is converged on the laterally over the arm, it is inserted into the lateral lip of the bicipital groove, and just lateral to this pectoralis major you can see there is a elevated area, it is called the deltoid, and in between there is a groove. This is called the deltopectoral groove, and this deltopectoral groove, it contains this vein, it is called the cephalic vein. So this cephalic vein ultimately open inside the axillary vein. Here you can see this is the axillary vein. I will show you. This is the pectoralis major. I will reflect. This is the pectoralis minor, and this cephalic vein which is open inside the axillary vein, and this is the continuation of the basilic vein. Now we will discuss about the axillary artery. Here you can see this is a axillary artery which lies posteriorly and superior to the axillary vein. So this is above and slightly posterior to the axillary veins. This is the axillary artery. Axillary artery, it begins at the outer border of the first rib. It is a continuation of the subclavian artery. So this is the axillary artery. It is a continuation of subclavian artery at the outer border of the first rib. It is end at the, here you can see this is a continuation of the axillary artery. It is the lower border of the teres major. This is a latissimus dorsi along with the teres major. It is the lower border of the teres major. It is continues as a brachial artery. It divides into the three part by the one muscles. It is called the pectoralis minor, and this pectoralis minor, it divides the axillary artery into the three part, proximal to its first part, behind to its second part, and distal to up to the lower border of teres major. This portion of the axillary artery, it is called the third part of the axillary artery. So these are the three. This is the axillary artery. Three part of axillary artery. First part proximal to the pectoralis minor, second part behind or retropectoralis minor, and third part distal to the pectoralis minor, and it becomes continues as a at the lower border of teres major. It continues as a brachial artery. Now I will show you the first branch of the axillary artery. Here you can see this is the first branch. It is a superior thoracic artery. This is a very small branch of the axillary artery. This superior thoracic artery which supplies to the upper border of, it lies at the upper border of the pectoralis minor, and it particularly supplies to the upper two intercostal space as well as the pectoralis minor muscles. Just behind to the pectoralis minor you can see there are two artery which is lies. One is the piercing to the clavipectoral fascia. This is the thoracoacromial vessels. These thoracoacromial vessels have again there are 4 branches. One which is goes inside the pectoral muscles, other which is goes inside the deltoid, other which is goes inside the clavicle, and one is the acromial. So these are the 4 branches of the thoracoacromial, but this is the thoracoacromial artery. Just opposite to it, there is one artery which is goes along with the lateral border of the thorax. It is called the lateral thoracis, and it supplies to the lateral wall of the thorax. Particularly, it is along with the anti-axillary lymph nodes. So these are the 2 branches. Lateral thoracis and acromiothoracis are the branches of the second part of the axillary artery. Third part of the axillary artery, which is the given, it is a largest branch which is given, it is a subscapular artery. Here you can see this is a subscapular artery. It is goes inside the subscapular region, and it also gives the circumflex scapular artery into the lower triangular spaces. Other 2 artery which is goes on the upsides, and the smaller one, this is a it goes anterior to the humerus. It is called the anterior circumflex humeral artery. Another which is goes along with the axillary now into the quadrangular space. It is a posterior circumflex humeral artery. And here you can see this is the axillary now, which is passes along with the posterior circumflex humeral artery. It is a axillary now. It is lies inside the quadrangular space. So sometimes what happens, this axillary artery which is blockage into this second part just behind to the pectoralis minor, this portion which is blockage, it lead to the, this is we will discuss about the clinical aspect. What happens, the branches of subclavian, it gives the transverse cervicals, and it gives the deep branch which is along with the medial border of the scapula. Here on that side my percept, which is goes on the medial border of the scapula, and deep branch of this transverse cervical which is goes along with the medial border of the scapula, as well as there is a suprascapular artery which is on the back side of the scapula on the suprascapular notch, and the laterally there is a circumflex scapular artery. It is a branch of subscapular artery. This all 3 artery which makes the anastomosis around to the scapula. So whenever this blockage of in second part of axillary artery, the blood which is passes through the branches of subclavian artery and via the anastomosis around to the scapula, again this artery like circumflex scapular artery, it is act as a channel to carry the blood to the axillary artery, and then distal part of the axillary artery as well as the brachial artery which receives the blood. So at that time this anastomosis, potential anastomosis around to the scapula, which is pulsatile, and you can feel the, you can put the hand over the scapula, you can feel the on the back of the shoulder over the scapula. When you put the hand over the back of the shoulder, at that time you can feel there is a pulsation, and it is called the pulsatile scapula. Sometimes also there is a hemorrhage, and axillary artery and veins which is lies inside the axillary seat. You have to remember always other relations of the axillary artery. Medial cord lies medial to the axillary artery, lateral cord lies lateral to the axillary artery, and this posterior cord which is lies posterior to the axillary artery. Particularly it is into the second and third part of the axillary artery.